So today we're going to talk about bursitis and in particular shoulder bursitis. And the reason is this is actually a request from a friend of mine who lives in Melbourne. And a little bit of a backstory is it was a few years ago, he had shoulder bursitis and he'd had it for about 6 months. And any of you who have had bursitis or shoulder bursitis especially know that it really, really hurts. I've had it before and I know that your arm just aches and you just want to chop it off sometimes. You just don't know what to do with yourself. So he was at this stage, it was really sore, went to a physio. The physio had given him a couple treatments and then had said, okay, go do these exercises. And the exercises were making him worse, so then he decided to stop doing them and stop going to the physio. And then it's been a few years later and it's just kind of slowly resolving on its own, but it got stuck at around 80-90% and it's not just budging that last little bit. So we were talking about it because we were all away skiing, and it was just he happened to fall on it and stirred it a little bit, so it brought up the conversation. And he was saying, I know you do those videos on Facebook, can you do one on bursitis? Because I think that would be really relevant to lots of people, and I agreed. So that's where we're at. So our treatment for bursitis, that's what we're going to talk about today, is how we break it down into 3 phases and why we do that, and how that gets you back to 100% versus 80% and never that last little bit. So when we treat bursitis, we break it down into 3 phases. So the first phase of treatment is hands-on treatment, and that is to get your pain manageable. And the reason we do this is because it's no good giving you strengthening exercises or any kind of exercises that stir you up. And when you're really, really sore with bursitis, anything hurts. If you sleep on it for too long, or if you do your hair in the morning, or trying to, tuck your shirt into your pants behind your back can stir it up, or, reaching for your bag on the passenger seat can stir it up. So there's no good giving you extra exercises to make you even more sore. So our phase 1 is we just do hands-on treatment, and when we start to get traction, you're starting to feel a bit better and the ache is resolving a little, that's when we move on to phase 2. And that is where we try and restore your range of movement. So when you've been in pain with your shoulder, often you'll be protecting it and you would have lost a bit of range of movement, or sometimes a lot of range. You can't reach up as high or behind your back or out to the side as far as you could previously. So our phase 2 is restoring that back to as good as we can. It might not be 100% in phase 2, but pretty good. And then once we've done that, then we move on to phase 3, which is our strengthening program. So that's where we really treat the cause of the problem. Bursitis and the pain that you get with it is actually just the symptom. That's not the cause. Something else is causing it, and often it's a weakness in the shoulder somewhere. So that is where we do need to strengthen you back to get your shoulder back to normal. But if you do that too early, you're just going to keep sending yourself backwards. So the phases, we don't compartmentalize them. You won't just do treatment and just do range and then just do strengthening. They kind of overlap a little bit. It will look like you have treatment and you'll have a couple exercises to do at home. And then over time, your treatment, your hands-on treatment gets less and less and your exercises increase until you don't need hands-on treatment because your pain's really good. And then you just have your strengthening program that you either do at the gym or with us, or if you're really diligent at home on your own. So for the next few days, we're actually going to talk about some exercises that you can do if you're in phase 3